So recording now taking place, so that's sorted out. And then next announcement is what Benoit would prefer, and I think it tends to work better, is if we take questions at the end of the presentation, and if you've got a question, if you put your hand up with the hand up function, and we'll take verbal questions rather than questions in the chat, just to make it more interactive, and then I think it tends to be a bit more easy to everyone to navigate. So let's get started then. So as I say, I'm delighted that Benoit has agreed to present this afternoon or morning or evening, depending on where you are. And just as a very brief sort of introduction, clearly at WHO, a great deal of exciting things are happening, but for many years, oral health really wasn't at the forefront of developments. But as we'll hopefully hear from Benoit now, there are several things happening that really are a very exciting opportunity for oral health. And because of the nature of our group's interest in terms of socioeconomic inequalities in oral health, we're particularly interested to hear Benoit's views on the way ahead in relation to inequalities, but also the sort of broader agenda in terms of oral health. So Benoit, thank you very much for agreeing to speak. And how about if you share your slides and then we'll look forward to your presentation. And if I could ask everybody else to mute themselves, I think we all know that now, but that would be great.
Okay, thank you, Richard. I just need. Is it okay now? You can see my
yeah,
slide.
That's fine, Benoit. Perfect. Thank you.
Okay, so thank you so much, Richard, for the invitation to be part of this meeting. It's a true pleasure and a privilege to be with you. I know that this network of experts in inequalities related to oral health is a very active network, and it's a pleasure to be there and to share some insight, yes, on what is happening now at global level and WHO level on this oral health agenda. So the main objective of my presentation is really to discuss with you how this oral health resolution adopted, as you know, this year during the World Health Assembly session could represent a true opportunity to change the way that health policymakers and other stakeholders, chief dental officer, but also a number of actors are addressing and responding to oral health inequalities in population. So more specifically, I would like also to take the example of the global oral health strategy, which could be considered as a kind of first baby of the resolution. And if the resolution may be considered as a maternal matrix of the overall global oral health initiative, the global oral health strategy would be the key policy document umbrella that will guide the development of the successive policy or technical products at global and national levels that we are all together supposed to develop for the years to come. So last year, 2020, and thanks to Sri Lanka leadership, I think it's important to just remind you that all these things have been quite well led by Sri Lanka, who has followed a quite complex and long process. So now the perspective in oral health have changed dramatically, and I think we can say that we reach a tipping point where oral health is recognized now as a global public health issue facing the world today. So this resolution is a strong signal to WHO that it must prioritize oral health, give it more visibility in the global health agenda alongside other NCDs, and ensure that oral health is embedded into universal health coverage. I think these are the big messages proposed by member states, and you can, of course, retrieve in the resolution. So the resolution outlined the strong agreement between member states to continue and accelerate the integration of oral health into both UHC and NCD agendas. So the resolution, of course, urged member states to strengthen the provision of oral services delivery as part of UHC benefit package, and to reorient the traditional curative approach towards a preventive and promotional approach to address the huge issue posed by the oral health inequality. So I hope that, of course, all of you already read and go through this resolution document. I think there are a lot of very important ideas and commitment also to change, to move, to improve the situation. Now it's our turn, to develop, based on this resolution and the key messages, to develop some key policy document. And you will see that we are quite already advanced in this process. So to act against these objectives, the resolution gives a strong mandate to WHO Secretariat. So you can see that WHO should develop a global oral health strategy by 2022, an action plan that would be a kind of translation of the global health strategy into concrete intervention that include a framework to track progress with measurable targets to be achieved by 2030. And in addition, I didn't put in the slide, but we have also a number of technical products regarding, for example, environmentally friendly and less invasive dentistry, but also a best buy cost-effective intervention, and also some decision, that would be taken regarding the integration of NOMA into neglected tropical disease. So you can see that the schedule is quite tight, but it looks like a real rare and positive alignment of planets, but it gives a huge visibility also to oral health agenda throughout all the upcoming EB Executive Board, but also World Health Assembly session for the next year. So now, of course, we need to speed up a bit. And the first step, of course, was the development of the global oral health strategy. And I will give you, of course, much more information later. But, this slide summarizes quite well, this number of plan activities, policy document so that we have to develop. And it's again a very exciting time, not only for WHO, I hope, but for member states, for all the researchers and the network of public health actors to really be part of this initiative. Now, back on inequalities in oral health. We are, I think, all more or less aware about the situation, the global situation. In 2019, based on GBD data, global burden of disease data, we know that more or less half of the world population is affected by oral disease and condition. So when we are thinking about oral health inequalities, the first ideas I think that come up is usually inequalities in terms of prevalence and severity of oral disease across the life course. Inequalities between different population groups, for example, rich and poor, rural and urban, or between different countries, low-income countries versus high-income countries. So a lot of studies have shown over the last and past decades this strong and usually linear association between such different group of population. So oral health status becomes in most of the country today a strong marker of health inequality. To illustrate this inequality in terms of oral health status, I just show you a chart. It shows, both prevalence and number of cases of children aged from 1 to 9 and affected by untreated dental caries in deciduous teeth. And this is according to World Bank income groups. So the small point, it's yellow, I think, on your screen, show the prevalence, and the blue bars shows the number of cases. So it's quite clear that lower and middle income countries are much more affected compared with high income countries. So it's just an example of this kind of inequalities we have at global level if we compare different regions or countries on a specific disease in this case. But it's, I think, also important to distinguish and separate inequalities in oral health status from inequalities in access to oral health services. So both aspects are equally important, I think we can say that, but are caused by different factors and therefore require different solutions to be addressed. So we know that we have also a huge challenge in terms of accessibility and affordability of essential oral health care across countries and regions due to a complex range of factors and determinants. So the chart on the slide shows the percentage of adults having access to basic oral health care according to, again, countries and income categories. So this is coming from the WHO World Health Survey carried out in 2012. So in high income categories, up to 80% of adults declared having access to oral health services, compared with an average of 35% in low income countries. I just also would like to mention, this the pandemic. I think it's difficult to make a presentation today without having at least one slide on this COVID-19 pandemic. And these are some figures, from a very recent kind of follow-up WHO survey on to measure, the level of disruption of NCD services. So it's a new WHO snapshot. I think every 6 months, I think the WHO try to follow and monitor the impact of COVID in terms of delivery and disruption of NCD services. So you can see that today, or at least the last month, you have at global level, and it's 136 countries reported this. We have more or less 50% of the dental services that are still disrupted in terms of urgent dental care. So the COVID pandemic has had and still have a negative impact on public health program and the provision of essential oral health care in most of the countries, leading to delays in oral health care treatment, increased antibiotic prescription, and again, greater oral health inequalities. So I think it's important to keep also in mind, even we are again living an exciting time for oral health agenda, but the situation due to the pandemic make the situation worse compared with before the pandemic. A last example also of kind of inequality we can have, it's related to, the implementation of Minamata Convention. So I think it's a good example of inequalities in terms of access of quality oral health care. So we also implemented a global consultation in March 2021 to monitor, this is just an example of the information that we gathered, but it's monitoring the regulation, restricting element bulk mercury for dental care, restricting also dental amalgam to its encapsulate form, and restricting the dental amalgam supply chain. And you can see there is also a strong and consistent gradient related to country income status with a relatively high level of implementation in high income countries. Last but not least, last chart, showing that during the last 3 decades, the combined global prevalence of the main oral disease has remained unchanged at more or less 45%, which is higher than the prevalence of any other non-communicable disease in population. So during the same period, as you can see on the slide, the number of cases of untreated oral disease has dramatically increased in all WHO regions. So to face this quite alarming situation, I think the Lancet journal was maybe, I don't know, the first one, but at least part of the people and the institution that sound the kind of alarm bell. It was in July 2019, and using the same messages, we have in the resolution adopted by member states. So they requested, radical reforms of oral health care and a more and better integration of oral health as part of both NCD and UHC agendas. Of course, all the participants today, I'm sure that know very well these two infographics. They have been developed a couple of years ago by UHC team, and of course they are still relevant today. Maybe we need Richard to upgrade them or to work a bit on design and layout today, but again they are still very relevant to think about this balance we need between upstream intervention and downstream intervention. So now thinking about the solution to address this, again, alarming situation and reduce the oral health inequalities, I think we have a kind of consensus among the global dental public health community. There is an agreement to invest more and better in upstream policies and intervention, with the objective of addressing the social and commercial determinants of oral health, as well, of course, as the well-known common risk factors common to the major NCDs. So we know that if we are continuing to focus and to invest on downstream factors such as clinical prevention, media campaign, or research on high tech for treatment and diagnosis of oral disease. It was the case, I think, for the number of decades, of the past decades. We know that these approaches have limited success in solving the problem we have, like reducing oral health inequality. And it's the reason that I really think that the resolution on oral health and the subsequent global oral health strategy looks like really appropriated to support and guide member states. And you will see that in the goal of the strategy, we have clearly mentioned that this strategy should really support the member states, the Ministry of Health, to develop strong national policy document to reduce, of course, the burden of oral disease, but also to to address the oral health inequality. So as you can see on the right side of the slide, both vision and goal of the strategy are closely aligned with the foundations and the values of universal health coverage for all. And UHC, of course, it's much more than making essential oral health care services to all. It also includes oral health promotion and prevention and rehabilitation intervention related to oral disease and condition. So now I will enter a bit more into details about the content and the structure of this oral health strategy. As you know, the result, the outcome, the global strategy is really the follow quite not long but intensive process that include the contribution from independent experts, but also we organize a web-based consultation, you know, asking member state, non-state actors to send the written input to improve, to finalize, to help WHO Secretariat to finalize the strategy. And this strategy, the final draft strategy that would be submitted to the EB session in January, in more or less 5 weeks now, is a really strong and good document, I definitely think. The written input we receive from a number, again, of institutions, non-state actors and member states really help us to improve the document. So I think that this document really now covers most of the important, you know, ideas and foundation, you know, to give a strong to give a strong support to countries for after that development of a national policy document. So you will see that it's the outline of this strategy, so background with also a number of essential important definition. The strategy will contain, for example, a new WHO definition of oral health. We have also, thanks to the question raised again by different stakeholders, we define or give some details about a number of key elements, what it means, for example, essential oral health care. This is through the background and global overview of oral health, and after that I will go through the, you know, this important aspect of the strategy is the guiding principle. So I think we have 6 guiding principles, and they are all quite simple and focused. And it's the reason that when we were working on this strategy, we really wanted to make a very easy, understandable document for of course, specialists and non-oral health professional, because the idea, of course, is that the policymakers, health policymakers in countries could really use and this document to, again, adapt and develop their own national strategy. So the principle number 1 is a public health approach to oral health. That means that first we have to target the largest number of people affected by the most prevalent or severe oral disease and condition. So it means that a public health approach requires intensified and expanded upstream action on social and commercial determinants of oral health, involving a broad range of stakeholders, not only in health sectors, but also in social, economic, education, environment, and any other relevant sectors. So based on this first principle, you can see that a priority really is given to focusing on on policy and upstream policies. The principle number 2 is primary health care. We know that it's the cornerstone of strengthening health system. So integration of essential oral health care in primary health care has a lot of benefits, including increased chance of prevention, early detection and control of oral disease and comorbidity, but also means more equitable access to comprehensive quality oral health care. And we know that in most of the countries, unfortunately, so far, essential oral health care are not really integrated. You have usually to go to the next level of health pyramid to find dental nurse or therapist or dentist in a big city urban area. So important to focus on this basic but essential principle of public health. The principle 3 is innovative workforce models to respond to population needs for oral health. And this is important to note that we have received so many inputs, from a range, really important range of stakeholders, non-state actors, academic, and also member states that explain clearly that workforce is definitely one of the top priority if we want to improve the situation. And it's based on this input that we decided to add a specific strategic objective related to workforce model. So the central ideas is to move out of these silo dental education models we know in a number of countries. Resource and workforce planning models need to better align education and training of health workers with public health goals and population oral health needs. Of course, particularly, for underserved population. So this may require reassessing the role and responsibility of mid-level and community-based health workers and other relevant health professionals that include oral health sector. So fortunately, there are some departments in WHO working on the implementation of a global strategy on workforce. So it's a good opportunity, I think, for the dental sector to work with them and try really to think differently the kind of the skill mixed workforce we need to make again oral health care available at different level of health system. Another principle is people-centered oral health care. So this concept, of course, fosters a more holistic approach to needs assessment, shared decision-making, oral health literacy, and self-management. So through this process, people develop the opportunities, skills, and resources to be articulate, engaged, and empowered users and stakeholders of oral health services. And this also, of course, is quite ambitious principle. We know that so far oral health services have been more dentist-centered rather than people-centered. But we also know that in a number of countries, the things are moving, and there are more and more research on this concept. Another principle is related to life course, the principle 5. People are affected, of course, by oral disease and condition across the life course, from early life to old age. So, of course, the effect of the disease may vary and accumulate over time and have, of course, complex consequences in later life, particularly in relation to other non-communicable disease. So it seems important to think about tailored, age-appropriate oral health strategy that include essential oral health care need to be integrated with relevant health program across the life course. So this may include age-appropriate, evidence-based intervention focused on promoting healthier eating, tobacco cessation, alcohol reduction, and self-care, and a number of other more specific prevention and promoting program. The last principle that we think that it's definitely a big place now already, but in the future, is digital technology for oral health. Artificial intelligence, mobile devices, and other digital technology can be really used strategically for oral health at different levels of health system. We have released recently, I think in September, what we call the Mobile Oral Health Handbook. And for those of you who are interested in understanding better, the approach developed by WHO, I think it would be a good resources. Now, in terms of strategic objectives, of course, the strategic objective provide the framework for prioritizing action to promote oral health and prevent and control oral disease. So this 6 strategic objective would be kind of 6 pillars of the upcoming global action plan on oral health. And again, the plan is to translate this 6 strategic objective into 6 concrete and relevant and evidence-based series of intervention. So you can see that I do not want to enter into the details. Again, the document will be available soon. But you can see that it's also follow a quite traditional way, of planning policy and different key aspects. You have oral health governance, and this is particularly important. We have also to ensure that at Ministry of Health level, oral health unit with a skilled chief dental officer will be also leading the process, the implementation, the development. This we know that it's a key if we want also to change and reform a number of aspects of health system and beyond. Oral health promotion, oral health disease prevention, still of course a key aspect, targeting common risk factors. Health workforce, so a specific strategic objective on health workforce. That would be quite interesting to develop innovative models and revise or expand competency-based education to respond to population oral health needs. We have also, of course, a big strategic objective on oral health care that will be toward integration into UHC benefit package. Oral health information system, as you know, it's also a kind of sometimes missing pieces of oral health program in countries. It's more and more difficult to get collect information and data. So we have to think to be so in this case more strategic and think about certainly a new set of indicators that will help, of course, decision makers to plan and to take some strategic decision. Research agenda also. We know that in this domain we need to have more research, toward public health intervention, population-based intervention. And this so it's really important aspect for the future. Here is just to show you that as part also of this strategy, of course, the message here is just to show that the strategy is not a WHO policy document only. The strategy is really for me and for WHO a global public health good. So we must all take ownership of this document, whether we are a researcher, dentist, hygienist, or public health actors, or engage in private sector. So we try to develop a number of role and responsibility for all these categories of potential actors. So it's really so somewhere a call for a strong collaboration, you know, across and among different non-stake actors. I think the success of this ongoing initiative and development of policy document will come from, again, a strong collaboration, a coalition, you know, on oral health. Otherwise, we know that implementation phase will be certainly difficult to achieve. It's my last slide. Just to mention that, again, there is now a quite clear roadmap for WHO, member states, and other stakeholders to achieve and to pursue this exciting agenda. We have a number of global public health goods to develop all together again, and for the upcoming global action plan or technical guidance will follow the same inclusive and transparent process, inviting time to time, you know, key actors to contribute, to get input. We think that it's definitely important. And of course, not the last stage, because we have still, we have to think already now about this implementation and country support, because we know that if we want to also bridge the gaps existing between countries and across the different region or income, again, talking about inequalities, we have also to be prepared, of course, to support the development of oral health policy at national level, and to mobilize, of course, funds and budget to support the countries in this agenda. So to just sum up a bit, oral health is no longer in the what we can call shadows, but definitely has been repositioned in the global health agenda. So the strategy and action plan that are under development will propose the best possible strategy and cost-effective intervention to address effectively the oral health inequalities. Implementation phase will come soon, and we have to be prepared to work together, and we have to raise resources to meet this quite historic challenge we have. Momentum is on our side. Thank you so much, and happy to discuss with you now. Thank you.
Thank
Over
you.
to you, Richard. Yeah.
Thank you very much, Benoit, for that great presentation, that great overview of developments at WHO. And as you say, that exciting agenda in relation to the wide range of different initiatives that are moving forward. I do take exception that I do have this is my upstream mug. That is my prized possession of the picture of upstream, downstream. So I'm glad you appreciate it, but perhaps we do need an updated version. So how about if we now open up for some questions from our audience, because we've got a very distinguished audience here this afternoon. We could call it the glitterati of oral health globally. So we've got academics, we've got chief dental officers, we've got IEDR, we've got a range of organizations presented here. So Benoit's now happy to take some questions. So do we have any questions from our audience? If you maybe put your hand up, and then we can start some questions. Unlike our audience to be so shy, but I can see one question coming up, and I can see that's from Carol. So Carol, thank you for your question.
Thank you, Benoit, for the great presentation, and congratulations again for the amazing work you are doing at WHO. Just a quick question. I attended yesterday the WHO webinar on commercial determinants of health. That was really interesting. I'm just wondering how oral health is linking with that initiative and that work within WHO. Thank you.
Yes, thank you, Carol. Yes, definitely. We are. I'm in contact with the colleagues. It's different department and division, but we are in contact, and we are planning to have at least one topic, on this webinar series on oral health and commercial determinants of health. So it would be next year. They are following more or less a 1 year agenda, but yes, we already agreed to organize something, and I've been in touch with some colleagues that to see if they will be happy to present or to contribute to this series. It's a great opportunity. I agree with you. Yeah.
Thank you. That's great.
Thank you. And just for the rest of the audience, that the WHO have this new initiative under the Social Determinants Directorate on commercial determinants. And the first meeting was held yesterday, and there's now going to be monthly seminars. I think there's a whole series of seminars on this topic. And as Carol said, it was such a lovely introduction and overview of the topic. It was really, really very good. So yeah, thank you, Carol. So how about another question? Jenny, over to you.
Hello, Richard. Hello, colleagues. And Benoit, thank you very much indeed for your presentation and the work that you and the team are doing at WHO. And it was great to hear the sort of workforce angle, because the workforce plays a role in relation to achieving change. And some of that needs to be at macro level in terms of developing a sort of public health workforce that can really influence at the policy level, as well as at reshaping care at the clinical level. So I've got a couple of questions, but I'll start with the clinical level first, and then I think it might be helpful at some stage to talk about actually what public health leadership workforce we need globally. But at the clinical level, one of the big barriers has always been the payment system and the funding system and payment system in terms of shaping change and using the workforce differently and different models of care. And so much of dentistry is provided in the private sector. How, is that a role that the WHO can play, or is it something that others ought to be playing to try and reshape models of care? Because actually we've got to take people with us on that journey. And a lot of it comes down to money and politics, and to what extent and whose responsibility is it to try and build at least models of good practice of change rather than sticking with established systems. Thanks, Richard.
Over to you, Benoit.
Yeah, thank you, Jenny, and thanks for the great support also that King College are providing to the program, on this specific workforce. I think it's really appreciated. Yeah, it's a big question. Of course, I do not have all the answers, but what is good, is of course, WHO has also different departments, and some of them are really specifically working on, for example, UHC, and it's a fantastic entry point, to think about what would be the best workforce model, what would be the model of care so we want to provide to the population. So I'm learning, of course, of all this initiative ongoing, mainly on this UHC. I think that it will really serve, our global oral health community to think a bit differently, and because I don't think it's a kind of discussion we could have, among ourselves, because it's definitely a good example of things that we have to share, and we have to compare, and we have to analyze with people who are not part of this dentistry model. And so it's really encouraging to see that for other colleagues working on the same question, but of course talking about healthcare more generally, that they are interested in this dentistry model. We have several. There is this dentistry model. You have also, eye care model, or some really silo, models. And so I hope that in upcoming months we'll put in place some working group, to think about how to pose the good question about this, and or to ensure that this oral health community, including dentists, providers, but also public health actors, will be part of this reflection. Because again, the solution is not between ourselves again, but really to contribute to a much more broader question about what is the best patient care model, and how to integrate accessible and affordable healthcare model. And all these questions will be again discussed among the healthcare community. So it's my answer for now, but for sure it would be a very interesting discussion and analysis that we have to do with all of you.
Thank you. Yes, I agree. It will be interesting and important. Thanks.
Thank you. Our next question is from James, who's got his hand up, patiently waiting.
Great. Thanks very much, Richard. And thanks, Benoit, as always, for a great talk. That slide deck really captures everything in a nutshell for this conversation, and I commend it to all. I'm going to follow on a bit on Jenny's point. I always take as a cautionary tale, and watched from afar because I didn't start in this position until 2016. The 2007 60th WHA passed an oral health resolution and developed an action plan. And then, unfortunately, that seems to have sort of echoed around the Dental Public Health echo chamber and not really gone anywhere. And I say that in sadness. And evidenced in my own jurisdiction in the Americas, I watched as Pan American Health Organization ceased its oral health programming and sunsetted the position of its oral health programming officer. And so this time around, of course, we need to be different. And we look at, I speak specifically to your roles slide, which was a marvelous slide. And again, following on Jenny's comments, the international organizations and WHO have been doing yeoman's work on this. Your office, the collaborating centers, IADR, FDI, ACFF, Lancet Commission, all essential pieces to the global conversation. Without that global conversation, the national conversations are much more difficult, particularly in countries that subscribe to WHO activities very closely. And so now at this point, we're moving to, if this is going to get done, the action now is at the national level in the member states, and this is no news to anyone. And a couple pieces there, I'd like your recommendations to a couple of cohorts. Firstly, the chief dental officers, the national chief dental officers, because as the secretary for the FDI's chief dental officer section, I'm sort of in the middle of a lot of conversations with my colleagues around the world, and there are a number of them who unfortunately aren't aware that this is going through their ministry. These files are going through their ministry, and the national position on this, let's say the oral health resolution or an EB 150 with a global oral health strategy, is even going through their ministries. And I'd like your message to them on that. And secondly, for the academic and advocacy communities, and realizing that now things have to happen at the national level, what's your message to them on how they need to get with their, if something's going to happen, they need to get with their respective health ministries and with their national chief dental officers to try to move this forward? Do you have any recommendations to those two groups of folks?
Thank you. Thanks, James. Always relevant questions, and you raise good points. Now, of course, it's you know, and you started by mentioning this 2007 resolution on oral health. It's true that usually when I presented a bit the other initiative, you know, I mentioned that on the past, it's true that we have had a number of opportunity, you know, to push oral health. 2007 is a good example, but after that, also at regional level, but also in much broader policy document, the oral health was mentioned because thanks to some support coming from some countries and non-state actors. But unfortunately, it has been a kind of fragmented, you know, oral health journey so far. But now, the last 2 or 3 years, I think it's definitely different things that has happened, and it's good. It's much more, let's say, organized or shaped, you know, to really for this time really to transform this into a success. So I am much more optimistic than compared with the past. Having said that, I think, and I try, you know, to share this message to chief dental officer to really for them to have this ownership and, you know, to bring this resolution and this upcoming global strategy to really mobilize at different level, ministerial level. I know for some of them it's difficult because they do not have the experiences or they do not have the responsibility. You know, it's difficult to reach and to have a direct communication with your Minister of Health. But I think that things are moving, and I hope that all this development will really help you to reach this this momentum. So happy also to follow with you know, specific maybe meeting to it's definitely one of the key activities that I have in mind, you know, with a number of colleagues to really support chief dental officer for them to make it easy and to really be able to create also a momentum at national level. It would be a key. If we are not able to put in place this, implementation phase will be difficult for sure, because it's one thing to have a great policy global document, but after that to translate this in the field, it's of course we know it's a lot of challenge. We have to.
Thank you, Benoit. Thank you.
Thank you very much. Next question, we've got Habib has got his hand up.
Yes, thank you, Richard. Thank you, Benoit. I think we need to have more discussions and presentations like this to other audiences rather than to ourselves, because I think if this strategy is to be implemented on a large scale and in as many countries as possible, we need to convince the non-dentists that this is a good thing to take up. And in follow-up of all the questions so far, this is a strategy. That means it is a guidance document. It is not mandatory for anyone to follow this. It's not a convention that you have to do as a government or as a ministry. You have to follow this. But the big difference to the resolution that James mentioned from 2007 is that the plan is an action plan plus a monitoring framework. And as the previous DG, Dr. Chan, said, what gets measured gets done. I think this holds a lot of truth, and we have seen this in other areas of health and public health. If there are baselines and benchmarks, you can hold governments accountable and stakeholders accountable for their actions. Maybe, Benoit, you can elaborate a little bit on on the ideas around this monitoring framework and how it ties in with the NCD monitoring framework.
Yes, sure. agree with you. As you know, Habib, it's true that so far it seems that we have reached a momentum or commitment, within the well, what we can call global ORF community, and this network, this meeting is definitely a good example of people, I'm sure, that are convinced by what we are planning to do. But we have to go beyond, for sure. And so yes, the next step you mentioned, the global ORF action plan would be definitely more concrete, practical intervention, and that will also be accompanied by a monitoring framework with indicators. So we set up a working group, and we have the chance of having a good group of experts. We have also a strong support from Thailand, Ministry of Health, but also a few academic, and just want to see maybe McGill University, who is really keen to work with us on that. So the plan is really to define a long list, the first set of indicators, certainly going through this strategic objective from governance, prevention, treatment, ORF care, research, and through a consensus expert, to revise this list, and of course to align this with what we are working on, and based on the global ORF report. I didn't mention the global ORF report, but it's also an important piece of this puzzle, and we hope to release it first quarter of 2022. And in this global ORF report, we have already established, based on the available information, quite interesting list of indicators for each country. So it would be a country profile with indicators on burden or risk factors, but also health system response, and also a few economic indicators. So based on this work, based on this working group, is now working on these indicators, we hope to organize a global consultation with the member state, with the countries, second quarter next year, to of course review this indicator list, and to think about target that would be in parallel with the global action plan also development. So it's kind of several parallel work streams that are ongoing, and again with this UHC compendium, what we call UHC compendium agenda umbrella, at WHO level. So again, it's the reason that I mentioned, the very positive alignment of planets. There are so many things. We are also working on base-based intervention with a group of health economic experts. So all these pieces of the puzzle, we hope definitely that we have in more or less 1 year, a very strong, practical, and adaptable to domestic context, national context, in countries by, within more or less 1.5 years or 2 years.
Okay.
Over to you.
Thank you, Benoit. I'm just very conscious of the time, and I think we should finish now. But I did wonder if I could ask maybe one final question, because looking at the audience, quite a few of us are academics from research institutions, and on your slides, Benoit, you've highlighted the importance of research. But as you know, apart from a few exceptions, such as the US, most countries, there's not dedicated funding for oral health research. And in many countries, people really struggle to get funding. I just wonder, do you think, is there a role for WHO to try and highlight the public health significance of oral diseases to then influence at a country level funding priorities for research? Is that something that you potentially could see WHO having a role at?
Well, good point, important point, difficult point. Finance and to raise, resources to make sure that this again global initiative will not be maintained into again nice policy documents. So I think the role and the responsibility of the WHO Secretariat is really to identify a group of champion, country champion on oral health. It's really our priority to ensure that we'll have some, of course, leaders. We have already Sri Lanka. Thailand is super supportive. We have also Japan. We have a number of additional countries who really show their interest to support this agenda, because we need this strong support. We are not expecting, having the 194 member states to support this, because there are so many priorities, so many agenda. But this is our priority, to identify and to work closely with few countries that really leverage this oral health agenda. After that, I think, as you mentioned, research, but also it would be a different aspect. And it's something that I discussed with the platform, oral health platform in Europe, and George and Nigel, who are also in the call, I think, in the beginning of the week. I think it would be great, with this idea of coalition, stakeholders, actors, to try to see if it's possible to mobilize additional funds, resources, we know that there are several foundations so that would be interested, and we have to think about this, but for sure it would be not WHO, in charge of this. Maybe it's a bit beyond our mandate.
Okay, thank you very much. So I think we've given you a whole range of questions there. So I think we really have got our money's worth from the presentation. So I think on behalf of the audience, I'd like to thank you, Benoit, for your excellent presentation and for all your hard work. There's an awful lot of things happening. It's a very busy time and lots of different issues happening. But thank you very, very much for your input, and thank you as an audience for coming along and listening. And what we'll do is we'll put this up on our website as a presentation for those not able to come. And we will have other seminars after the holiday season in the coming months ahead. So thank you all very much for your attendance. And thank you, Benoit, once again for your presentation. And we normally would say a safe journey home, but I think a lot of us are sort of at home, but wherever you are, have a good holiday season, and we'll see you all again soon. Thank you very much.
Thanks.
Bye.
Thanks to all. Yes, bye.